Welcome to The Explainer. I am absolutely thrilled to jump into this one with you today. Consider this your fast-paced clinical drill session for reading arterial blood gases flawlessly. Today, we're going to build some serious visual muscle memory. Our primary focus is going to be mastering the first and second arrows according to the ROMS rule. Once you get this down, you'll be able to look at a set of lab values and instantly know exactly what's going on.
So tell me if this sounds familiar. Have you ever found yourself completely freezing up when someone hands you a fresh set of ABG numbers? You see the pH, the CO2, the bicarb, and suddenly it feels less like medicine and more like a highly stressful math test. Well, you're definitely not alone in that. But today, we're setting up a totally foolproof visual two-arrow method that literally solves this problem in seconds.
Okay, let's dive right into this superpowered technique by defining our core acronym, ROMS. This simply stands for Respiratory Opposite Direction, Metabolic Same Direction. It is a brilliant pattern recognition technique that completely removes the guesswork from identifying primary acid-base disorders. Understanding how to use the first arrow for your raw data and the second arrow for this ROMS rule is going to guide absolutely everything we do today. Here is our quick game plan for the explainer. We'll start with the two-arrow ROMS method, then move into the acidosis practice drills, followed by the alkalosis practice drills, and finally, wrap up with mastering your acid-base analysis. All right, let's get into it. Part 1, the two-arrow ROMS method. There are exactly 3 steps we're going to use for every single case today. Step 1, you draw your first arrows based purely on the raw lab values. So are they high, low, or normal? Step 2, this is where the magic happens. You apply the ROMS rule to draw your second arrows. And step 3, you simply compare your second arrows to whatever direction the pH arrow is pointing. Whichever one matches, well, that's your diagnosis. It really is that straightforward. Let's walk through our first example kind of slowly to get the hang of it. Our pH is 7.52, which is high. So our first arrow for pH goes up. CO2 is 28, which is low, so its first arrow goes down. Bicarb is 24, perfectly normal, so its first arrow just goes sideways. Now for step 2, calculating the second arrows. Applying ROMS. Respiratory means opposite, so the CO2's downward first arrow means its second arrow points the opposite way, which is up. Metabolic means same. Bicarb's sideways arrow means its second arrow stays sideways. Finally, step 3. Look back at the pH. It's pointing up, right? Which second arrow is pointing up? The CO2. Since CO2's second arrow matches the high pH, we have a respiratory cause. And a high pH always means alkalosis. Put it together, respiratory alkalosis. So the absolute most crucial point before we hit our rapid-fire drills is to permanently lock this visual in your brain. Respiratory, which is your CO2, is always going to generate an opposite second arrow. If the first arrow is down, the second arrow is up. Metabolic, which is your bicarb, is always going to generate a same direction second arrow. First arrow down, second arrow down. If you can visualize that one single rule, you've already won half the battle. Okay, time to pick up the pace. Part 2, the acidosis practice drills. Let's check out example 2. We've got a patient with a low pH at 7.28, so first arrow down. CO2 is high at 58, first arrow up. Bicarb is normal. Applying ROMS, that high CO2 flips to a downward second arrow because it's respiratory. It perfectly matches our downward pH. Boom, respiratory acidosis. On to example 3. pH is low at 7.22, first arrow down. CO2 is normal. Bicarb is low at 16, first arrow down. Now let's apply our rule to get those second arrows. Bicarb is metabolic, so it gets the same direction, second arrow. It points down. It matches the downward acidotic pH perfectly. This gives us metabolic acidosis. Keeping the rhythm going with example 6. pH is 7.18, very low. First arrow down. CO2 is 60, which is definitely elevated. First arrow up. Bicarb is normal. Second arrows? Well, the elevated CO2 gets an opposite downward second arrow. This perfectly matches the downward pH. It solves the puzzle instantly as respiratory acidosis. See? No complex math required at all. Let's pause briefly on example 7 to let you guess this one with me. pH is low. CO2 is normal. Bicarb is low. Where does the second arrow for bicarb go? Yep, that's right. The exact same direction. It dictates a downward second arrow matching the downward pH arrow perfectly. The diagnosis? Metabolic acidosis. Now, example 10 looks a little tricky at first glance.
Watch this. pH is low, first arrow down. CO2 is low, down. Bicarb is low, down. Everything is pointing down. But do not panic, just trust the ROMS process. For our second arrows, CO2 gets an opposite arrow, so it flips up. Bicarb gets the same arrow, so it stays pointing down. Which second arrow actually matches our downward pH? Only the bicarb. So for sure, it is metabolic acidosis. The system works every single time.
Fantastic job on those. Let's shift gears to part 3, the alkalosis practice drills.
Starting example 4, our pH is high at 7.48, so first arrow goes up. CO2 is normal, bicarb is high at 32, first arrow goes up. Applying ROMS for our second arrows, since bicarb is metabolic, its same direction second arrow shoots straight up as well. It perfectly matches the high pH, giving us metabolic alkalosis.
Moving to example 5, our pH is high, first arrow up. CO2 is quite low at 20, first arrow down. Bicarb is normal. Applying ROMS, that low CO2 creates an opposite, upward-pointing second arrow. This second arrow perfectly locks in with our alkalotic, upward-pointing pH. The result? Respiratory alkalosis.
Example 8. We've got a high pH, arrow up. Normal CO2, high bicarb, arrow up. Since bicarb is metabolic, it generates that same direction upward second arrow. The match is super clear here, metabolic alkalosis. And this brilliantly illustrates the real power of the method in our final drill, example 9. Look really closely at this one. pH is high, arrow up. CO2 is low, arrow down. Bicarb is also low, arrow down. So both of our primary labs are low. But when we apply ROMS to generate the second arrows, CO2 gets an opposite upward arrow. Bicarb gets a same downward arrow. Despite two low values originally, only the CO2's upward second arrow matches our high pH. The diagnosis? Respiratory alkalosis. The arrows never lie. Now for a wrap-up. Part 4, mastering your acid-base analysis. So the most crucial point to take away from today's explainer is just how beautifully simple this visual system is. The ROMS method completely removes the guesswork by simply mapping the raw data to the first arrows, and then applying the ROMS rule to generate the second arrows. The correct diagnosis literally points itself out to you. You just find the match, and you have your answer. You've absolutely got the visual muscle memory down now. So my challenge to you is this. If a simple 2-arrow trick can completely demystify something as notoriously complex as acid-base analysis, well, what other complex medical puzzles are just waiting to be solved with a simple visual rule? Thanks for joining me on this explainer, and keep looking for the patterns.